We wanted to thank you all for joining us this afternoon for this roundtable discussion on how food policy councils are addressing the COVID-19 pandemic. We hope that all of you and your families are staying healthy as best you can and hanging in there during these challenging times. And we also want to thank everyone for doing all the work that you're doing to support your communities through these challenges. So today, my name is Rachel Santo, and I'm a senior program coordinator with the Johns Hopkins Center for a Livable Future and the Food Policy Networks Project. Co-facilitating with me today is Karen Bassarab, a senior program officer with the center. And we're delighted to have with us this afternoon 6 panelists representing a variety of different food policy councils across the US. Heather Bruskin with the Montgomery County Food Council in Maryland, Noel Didla, who's in Jackson, Mississippi, representing the Mississippi Food Policy Council and the Mississippi Food Justice Collaborative, Michaela Freiburger with the Dubuque County Food Policy Council in Iowa, Don Plummer with the Pittsburgh Food Policy Council, Nessa Richmond with the Rhode Island Food Policy Council, and Dana Wood with the Safe and Abundant Nutrition Alliance in Colorado. Before we begin today, I just want to briefly go over a few features of Zoom, which is the conferencing system we're using today. Firstly, you're all muted right now, and if you have a question, you can raise your hand and we'll unmute you during the conversation, or you can type your question into the chat box, which you can open by floating your mouse along the bottom of the bar if you're using your computer. We also have an option for panelists who are calling in to be able to unmute and also to raise your hand. So if you want to raise your hand to ask a question during the question and answer part of the conversation, you can hit *9 on your phone. And if you need to unmute, you hit *6. But at the beginning of the conversation, we're going to start with the panelists speaking to a few questions to kind of set the stage for what's going on in their communities and how their food policy councils are responding. And then Karen and I will begin to ask some of the questions related to their efforts that a lot of you submitted during registering for this roundtable. And so after that, during the conversation at any point in time, if you have any questions, you can chat it into the chat box. But after we start asking some of those questions, you can start raising your hand and continue to ask questions. And we also encourage you, if you would like, to share what's going on in your community with your food policy council, especially if it pertains to some of the questions that are being discussed. We more than welcome you to raise your hand and share it as well. That's part of the reason we made this a webinar, a roundtable discussion in the meeting format versus a webinar format, so that participants can also join in and share. And we're also going to be recording the discussion today, and we'll post it to YouTube afterwards, and we can share that link with everyone who's registered after the discussion is over. And as we mentioned before, this roundtable is being hosted by the Center for a Livable Future. We're an interdisciplinary research center located at the Johns Hopkins Bloomberg School of Public Health. Our work focuses on the intersection of diet, the environment, food production, and public health. And the Food Policy Networks Project is one of our projects. We have the goal of building capacity of food system stakeholders to reform local, state, regional, and tribal food systems through effective public policy. We do that through training, sharing best practices, networking with other food policy groups and leaders, and developing and providing food policy resource materials. If you're not familiar with the Food Policy Networks Project, we encourage you to check out our website and sign up for our listserv to hear more about future webinars. And so, without further ado, I'm going to jump into starting to talk to our panelists and ask them more about their experiences. So we're going to start by asking each of the panelists to describe the food system challenges that their community is currently facing due to trying to contain COVID-19. What is your food policy council doing, and what has been the response of your local and state governments to food system issues arising during the pandemic? And as you're talking about this, it would be great if you could share what resources, partnerships, and processes did your Food Policy Council have in place that has contributed to your ability to react to the pandemic, and where are the gaps in your Food Policy Council's response? How has this crisis, or how will this crisis change the focus of your work as a Food Policy Council? So we're going to have each of the panelists start with a brief introduction and talk about those 3 questions. So you each can have 5 or 7 minutes or so to talk through that, and then we'll open it up for asking further questions. And I guess I'm going to go along the top that I see. So Michaela, if you would be willing to jump in first, that would be great.
Sure. So my name is Michaela Freiburger, and I am the chair of the Dubuque County Food Policy Council, which is located in Iowa. So we actually have some unique challenges as we connect directly via bridge to Wisconsin and to Illinois. So I will talk a little bit about that as well. So our Food Policy Council at the moment is working to be the lead at our county level to collect all of the data as it relates to food insecurities, as well as food access. So we are a very urban-centered community as it relates to the city of Dubuque, and then we also have many rural communities that are outside of the city, necessarily kind of like a suburb of our city. So they each have their own unique challenges, as in access is very difficult. Many of them are dirt roads, or the community themselves have one or two spaces that the community can actually go and collect food from. No true meal sites or opportunities are available in that area. So our challenges that we're working to address with our local government bodies is how do we reach out into those areas where there is a food desert necessarily. And the population that we are looking to help are farmers, many of which are not producing food production. Many of the acres in Iowa are actually for animal food production and livestock. So they are in need of quality food to be delivered to them, and continuing to support our local farmers who are in food production. And our farmers market this last weekend, we have a winter's market, was closed. So we were unable to have people go and collect food tomorrow as well. So can we reach those farmers individually, because there's no true network to have that food be brought back into our community. So right now, the city and the county of Dubuque in Iowa have taken some additional steps further than what the state of Iowa has taken. They are trying to be 2 steps ahead of what's going on in Iowa. So social distancing has been something that's been recommended for quite some time here in the city of Dubuque and then the state of Iowa as well. So yesterday we found out that we have 1 case of COVID-19 in our county. So we are looking at keeping our restaurants at least open and getting the food to the restaurants as well. So those are some partnerships that we're trying to build and connect people to. So many of our restaurants also serve as bars. So they have made the decision just to close, as food is not a major part of their business model. They just offer it. And we have a couple places that I've connected people to donate their products to, as they've recently received a shipment and they're not going to be able to use the majority of their products for the next couple of months. So we have a couple rescue mission. We have a food bank that does a large distribution to the majority of our food pantries. We have a new not-for-profit, it's 2 months old, who has stepped up to the plate to help fill in the gaps from the Dubuque Community School District to feed children. And we have an urban farmstead that's allowing them to collect their goods there and then people to pick up products there. Also in Dubuque, we have a large Marshallese population. I believe it's the 2nd largest in the United States. So we are looking to continuously work with that population to make sure that they have food that they need, as many of them are food insecure. So in Dubuque, I have worked as the facilitator for all of this information, and everyone has been told to send the information that they're working on to me to see how we can build community and collaborative partnerships. So our Food Policy Council has been putting our fingerlings out into the county even further to see where the needs are. And so far, our Board of Supervisors has appreciated our foundation of community partnerships and our community connections to continue to grow our network a little bit further in this time of emergency. And we are very interested in sharing some of our programs, one of which is our urban bicycle mission. This urban bicycle mission it goes into one of our most needy community areas in the heart of downtown Dubuque. They have 4 different locations, and every Sunday they have a bag of snacks for the week. They attempt to be as healthy as possible and try to shop local as possible. And they also make a hot breakfast or a hot burrito for people to consume that evening. So they look to stretch that a little bit further. They have the need of volunteers because they've had to switch their format. Typically, they ride around on their bikes and meet people where they are. However, due to the epidemic and the pandemic, and people are hiding in their houses now. So they have to shift it to specific sites. So they have 4 sites people are to collect things at. And even then, they're still finding it hard to reach people. So the bicyclers then have to kind of go around and see where they can drop food off to people. And so we're trying to reach out as best we can with the Board of Supervisors here in Dubuque County in Iowa, as well as the other Iowa food policy councils, to connect together our thoughts and resources. As you know, we also recognize there's many farmers that are being impacted without their sales at farmers market. There's many farmers that are being impacted with food loss as well.
Thanks, Michaela, for sharing what's going on in Dubuque County. Dawn, do you want to go next?
Sure, and please feel free to, flag me if I'm kind of going, I don't want to go too long. How long do you think we should?
Around 5 minutes is
5
good.
minutes. Okay, great. So thank you so much for the opportunity to, I'm just really excited to be with you all and learn and share. We obviously, have been working hard in this last period of time. I think that for me, what has become really clear, and I guess it really became clear yesterday when I was reviewing, the governor of Pennsylvania declared all non-life sustaining businesses to close. And when I was going through the list of those businesses, the businesses across the food system are all life-sustaining businesses. So this isn't news to those of us who work in the food system, but just to remember that, this isn't something, sort of a hobby. This work isn't, something that we do just for kicks, that we understand that our role is a life-sustaining function that provides for the right to food in our communities. So I think it's really important to think of that. I also have been trying very hard to kind of distinguish the frame of charity versus justice. So in this time, we really are in a moment of push around charity. We need to make sure that we activate our charitable food and emergency food networks. But I think keeping our eye on the justice side is important as well. So really looking at, the equity of the policies being proposed, whether they're at the federal, state, or local level, and making sure that we have those communities that are most vulnerable around us at the center when we're looking at those policies and who will benefit from them. So that for us is, frontline food service workers, that's farmers, that's small business owners, restaurant owners. And I think the economic aspect of the crisis is really something that obviously will unfold for a long time, but I think we're well positioned as a food movement to kind of come in with the visions that we've been developing in our communities for a long time. And now is really kind of, it gets real. Not that it wasn't real before, but for example, we have been working on a Greater Pittsburgh Food Action Plan for the last 2 years. We're actually almost finished with our set of recommendations and strategies that we were planning to share at the end of March for public comment period. We'll continue to do that, but we're, even as we speak, pulling on some of those strategies to kind of deploy now. So I just kind of wanted to underscore that for us, we have a lot of assets. We're very geographically lucky to be in a place that has a really strong extractive industrial history, that has large endowments that support good work these days. So we have a lot of philanthropic support. So our Food Policy Council is an independent council, and we have 4 full-time staff, which is unusual and very helpful to us in this moment. We also, because of the work we've done, we've been in existence for the last 10 years. We have a pretty robust network of contacts across the system, and we've served as the, in the role of convener for a while. So it's easy for us to step into that role, whether it's convening growers or local government officials, or convening kind of our whole membership. And that's actually a process that we're working on right now. We've been frustrated in recent years about our local officials kind of understanding of their role. They're often very thankful for the nonprofit community that exists to provide for food needs, but we've been saying, we really do need a strong public role, because the market itself and just a network of nonprofits can't meet everyone's needs, and that these are policy questions. So this really gives us that opportunity to bring in our local officials more. Our region is also, because in part that philanthropic base is strong, we have 3,000 nonprofits in Allegheny County, which is the county in which Pittsburgh sits in. So that's a really robust network of organizations that are activated right now. So some of what's been helpful for us is knowing kind of the landscape of networks at the state and local level that we've been able to plug into. It's hard, and to kind of connect in this time, in general, normally, and under stress, that's also difficult. We also have a really strong set of our Greater Pittsburgh Community Food Bank is a strong food bank with community-based partners for food distribution and a broad distribution situation. So we have increased produce to people free food distributions, that they've modified their distribution process, where they're having people line up in their cars instead of lining up in person. So that's one, that's obviously for people who are coming in cars. So that's, I'm sure they're also adjusting for people who are coming by foot. And we also have a strong food recovery organization called 412 Food Rescue, who may be in some of your communities as well, because they've expanded their model to other locations. But they essentially have an app-driven model that is utilized by volunteers. And so they've really been working with the restaurant community that has a lot of food on hand that isn't being used. And so mobilizing that food to a network of nonprofit partners has been really important. We see our role as kind of this meta, kind of trying to connect the different networks. So one thing we're hoping to do is survey our members and anyone who wants to kind of chime in as to essentially what are their needs that they're seeing, and what are the strengths that they have to offer in this time, and what do they think our role as a Food Policy Council can be. So we're trying to collect that information, as well as convene people on a platform like this. We've never really used this kind of platform, so I'm really hoping for the best, that it's not technologically challenged, but we're really, it'll be exciting for us to be able to kind of ramp up our ability to function like this online, which will really help our geographic spread and access issues to our meetings and participation. In terms of, let's see, what else did I want to say? Yeah, I think that's kind of it. I mean, I guess, I'm reminded of the Sweet Honey and the Rock song, I think it is, that says, we are the ones we've been waiting for. So as the food movement, we've been, pressing for change, working to coordinate, and we really need to step into those leadership roles even more in this time. I guess one other thing I would say is we are also trying to figure out we see kind of a variety of disruptions that are or will continue to happen in terms of, broad layoffs and firings of, service workers. And how do we support them in this time is a question. We're also seeing a lot of increase in sales from farms and local food stores and things like that. So how do we work to accelerate that and connect consumers to those opportunities? And also a need that I think we have is, I've been really curious where to look in terms of understanding the national or global food supply chain. You know, we get a lot of our food from California and the South and Mexico and other places. We've, you know, very small smidgen of food comes actually locally. So, you know, I know that the visa interviews have ceased. And in terms of the, you know, those who actually harvest our food within our United States, you know, that's already adjusted. But now, if those workers aren't able to serve that function for us as eaters in the country, how do we, you know, there's just so many equity and justice questions here, but also including, you know, how do we kind of fill that void, or what does that disruption look like, and how do we prepare for it with our farmers and distribution networks? Lots more to say, but maybe I'll leave it there.
Dawn, before you move on, there was a question in the chat box about, would you tell the name of the food app platform again?
Yeah, oh, what's the name of the app? It's 412 Food Rescue. I should know the name of the app, but I don't. I'll look it up and I'll put it in the chat thing.
Okay, and then are you all using a specific kind of virtual platform to start convening? We
actually were looking into Zoom, and I think we found that you can get access to Zoom for $15 a month. That gets you 300 spots. So I don't know if that's what we're working on here, but that's what we're thinking about, even if it's just for 2 months or a couple months, but yeah.
Thank you.
Mm-hmm.
And thanks, Dawn, for your useful and insightful approaches around framing this. I think that you brought up a lot of really important points about charity and versus justice and policies. And I think that's something that food policy councils are already talking about before, but it becomes really relevant in these times. Noel, do you want to be the next person to share?
Sure. Thank you. Free the land, everyone. I'm representing the Mississippi Food Policy Council, a state level entity, and I'm also grateful to represent the Mississippi Food Justice Collaborative, a partnership of 8 organizations across the state of Mississippi. I hope you all are surrounded by love and care and are able to take care of yourselves, your loved ones, and your communities. We have 80 confirmed cases across 21 of the Mississippi's 82 counties, and so far we have 1 death due to COVID-19. As the poorest, second most food insecure, and as a state with repressive anti-Black, anti-Indigenous, anti-Brown, and anti-poor people policies that continue to govern us, it's been a relief to see some necessary shifts happen at the state level. It's affirming to see community responses to address the immediate needs, collectively vision the long-term work, and create a framework of food systems actions in real time as the situation is evolving. In response to the emergencies and urgencies, the state has declared an public emergency, and schools are closed till mid-April with testing suspended. Many cities across the state are taking civil emergency measures and have moved to mostly remote work for non-essential personnel, and restaurants are asked to provide curbside service, and bars have been asked to completely shut down, and all social events are canceled till the end of April. The governor signed an executive order to allow schools to provide meals on the go. We do not at this time have data on all school districts participating in this, but there's information on some public school districts addressing child hunger by providing meals on the go, as majority students in all districts across the state of Mississippi are on free or reduced lunch. Some of the challenges we are facing are access to equitable health care for those in rural Mississippi, access to equitable testing for all, including undocumented, incarcerated, elderly in-home and care facilities, and those in mental care facilities. Access to food for children, elderly, undocumented, disabled, and terminally ill and at home people was also identified as a challenge. As restaurants and bars across the state are closing in response to flatten the curve, restaurateurs, food distributors, and producers are figuring out ways to address their individual challenges. Casino workers on the Mississippi Gulf Coast have been let go because of the closure. Many of the Vietnamese, African and Caribbean immigrant, and African American community members rely on those businesses for income. The Board People SOS, a Vietnamese organization, is ramping up efforts at this time to do a census with their community members, but do not know how that's going to happen as situation is evolving and escalating. The same applies for folks engaged in oyster production and shrimping also. The Food Policy Council, as part of the Mississippi Food Justice Collaborative, has so far had conversations with the communities we serve to gather all of this info and share this info with philanthropy to figure out responsive strategy. As individuals and as members in our communities, we have been responding to the multiple collective care processes, such as meals distribution. The collaborative, our relationships to each other as individuals, our food system fellows, and our extended relationships with folks across the spectrum, cultural work, policy, advocacy, and organizing are the immediate resources we can trust in this moment. A couple of years ago, those of us that do food systems work realized the need for us to become unapologetically transformative in order to build and sustain regenerative food systems. In that vein, we assessed our roles as food policy councils, food justice advocacy spaces, organizing spaces, food producers, fisher folk, food justice nonprofits, etc. We realized that we needed to strengthen our capacity of work, capacity of collaborations, and capacity of being principled and people-centered to be impactful. We realized that we needed to be driven by ethics and public health. As such, the Policy Council and 7 partners worked to identify shared beliefs, values, and principles upon which the foundations of the food systems work will be concretized. After co-creating and committing to our beliefs, values, and principles, we are currently on the path to be human rights centered, racially equitable, environmentally just, economically equitable, public health centered, labor rights driven, ethical leadership driven, and food sovereignty centered to transform the food systems across the state, along with our partners, Board People SOS, Hijra House, Mississippi Band of Choctaw Indians, Mississippi Farm to School Network, Mississippi Food Corps, NCAT Gulf States, and Milestone Cooperative. The responses COVID-19 is necessitating from governments to us as humans has only reaffirmed our path to centering human dignity, human rights, equity, and justice at the core of doing food systems work as a food policy council and beyond. I have a bunch of resources and I'm going to share that in the chat box. That's all I have for now.
Thank you very much, Noel. And thanks for all you're doing in Mississippi. Nessa, would you like to talk next?
Sure. Let's see. So I'm Nessa Richmond. I'm the network director of the Rhode Island Food Policy Council, which was established in 2011. It's a statewide non-governmental food policy council. It has 25 seats, and it's the only food policy council for the state of Rhode Island. So during this crisis, we've been definitely pulling on our key strategies, which are to build coalitions that align resources, to promote good food and agriculture policy, and to undertake particular projects and programs that fill critical gaps. So our food system in the state is facing a lot of challenges due to the pandemic. We've got over 50,000 residents of the state who are at risk of hunger each day, and their food access challenges are only being exacerbated by this crisis. And then in terms of our food economy, Rhode Island's worked hard to build a good food economy, farms and fisheries, processors, restaurants, farmers markets, and the economic impact of this crisis is already driving a really sharp fall in both consumer and business spending. So, which is, adding to layoffs and unemployment levels rising really sharply in the state, and thinking about into the future about food business investment contracts and corporate bankruptcies and little businesses going out. So also a lot of significant pressure on the banking and the financial system. So we don't have a lot of agricultural land in the state, but we're very much a foodie state. We probably have the most farmers markets per capita of any state, and a lot of restaurant-based tourism, hundreds of small entrepreneurial food businesses, and we have 400 miles of coastline. So we actually have quite a sizable commercial seafood industry and aquaculture industry. So in terms of how we've responded specifically to the crisis, the current crisis, there are 4 things that we've been doing. First, we put together a resource for both the food access side and the food business side. So this has been something that I can share the link in the chat, but we've shared it over our website, social media platforms, and then also through our state's Interagency Food and Nutrition Policy Advisory Council, which has representatives from all of the different state agencies who touch at all on food, everything from Department of Education, Corrections, Health, Environment. And so it's been shared out a bunch, and that appears to have been a useful resource. It's been shared a lot. We've broken it out into 5 sections, and we're keeping it updated regularly. So the sections are food access resources, food business sector resources, consumer, then a specific carve out for agriculture and fisheries, and then just general food system resources. Second, we are hosting a Zoom-based council-wide roundtable on Monday night for our 25 members to share their needs and their resources from their different perspectives. And we will assess at that time whether we should do that regularly and take council members' input about how often that should happen. Third, we are preparing an open letter to the governor that will support 2 key needs for the food industry. The first is one that would confirm farmers markets and other direct marketing venues being considered as essential businesses. So allowing them to stay open. And I know that the Department of Homeland Security just put out a memorandum of identification of essential critical infrastructure workers yesterday. And that memo has a list of the different types of food and agriculture workers who are considered essential, which includes, in addition to grocery stores, other retail that sells food and beverage products, and a long list. I can put the link to that in the chat as well. But I think that for anyone who wants to write a letter in support of farmers markets being allowed to stay open as grocery stores are, that this letter from the Department of Homeland Security will be a useful resource. Then the second piece in that open letter is supporting getting grocery, farmers market, food hub workers, other food workers recognized as first-tier emergency responders, which we believe will allow them to get better access to testing. And then the fourth piece is that we are acting as a core partner with our state's Department of Environmental Management, which is convening the other agencies, specifically health, commerce, education, and the Department of Labor and Training, along with food and farm stakeholders weekly. Our first call took place this morning, and there were a bunch of different outcomes of that call, including a discussion of our shared use kitchens becoming commissaries for meals, prepared meals for people in need that could be delivered to their homes. Also redirection of local food sales capacity. As an example, a food hub that was serving institutions and restaurants pivoting to do home delivery of local food product. Another example is we have a large farmer distributor who is going to have empty refrigerator space due to the changes in the market and loss of restaurant sales and institutional sales. So they are offering that refrigerated space that they have to emergency food providers and others as a new point for additional capacity for that type of emergency food need distribution. We're also on that call was sharing of best practices for farm stands, for farmers markets, for U-Pick operations. These aren't all open in Rhode Island right now, but we want to be prepared. In terms of resources and partnerships, I think we're lucky that we're a small state. Everyone is really pretty well networked. We also have a really good group of council members who can help us aggregate and amplify our messages, including the director of the Rhode Island Food Dealers Association, our University of Rhode Island, our land grant schools, extension, a gleaning group, and then obviously farmers, aquaculturists, community gardeners, and others. For some specific resources that we've been using, we use Basecamp as a platform for almost all of our communications already. It does cost money, but there is a nonprofit discount. We also use Zoom as a platform, and we have a lot of standard operating procedures built up around use of Basecamp for voting and quick turnaround so that we can move quickly. We have like a 48-hour turnaround for most things related to policy and other types of outward facing communications. We also use, a couple different social media platforms and an e-newsletter. In terms of the state agency's role, the fact that the state has an interagency food and nutrition policy advisory committee that quarterly pulls together people from all of the agencies to talk about food systems issues is huge. I don't know what other states or counties have something like this, but at this particular point in time, that group has proven really useful in terms of addressing the food systems challenges, and they're a great resource for us in getting our work out as well. Finally, in terms of gaps, I think that was the last question. I feel like we need to work with the state to get specific information out to specific audiences better, audiences who may not be primary targets of state agency outreach. And as I mentioned, like best practices for community gardeners, best practices for farm stand operators, and best practices for aquaculture and commercial fisheries are places where there may be an FAQ out there, which is awesome, but we need to convene our folks to get that word out to them, directly, as opposed to just sending them a link to a piece of paper that some of them might not, even receive. That's what I've got.
Thank you, Nessa. And just a quick question, or we had two questions around if you could share, if you have them listed somewhere, your Basecamp operating procedures with the group on the call, or we could share it afterwards. If you don't have that, that's fine too. But
okay, I'll try to stick some stuff in the chat.
Great, thanks. Do we want to go to Dana next?
Hi everyone, can you hear me? Cool. First, I want to say that I feel very honored and blessed to be on this call with all of you amazing folks doing this work around the country. So I applaud your efforts and know that your work does not go unnoticed. And I feel very privileged to be able to represent 3 rural resort communities in Colorado, in Western Colorado, Garfield, Eagle, and Pitkin County. We are all a partner group on the Safe and Abundant Nutrition Alliance, SANA for short. And our group is fairly new. We have only been in existence formally for the last year. However, a lot of our groups across these 3 counties have been doing work around food access and food equity and food justice for around 6 to 10 years. Right now, we have a lot of boots on the ground for our communities. Funding is definitely a huge challenge right now for our primary food access groups, a part of this coalition. We have several community groups on the ground within our coalition that have been funneling up information from community members on their needs and wants. And I think our partners at the state level, Hunger Free Colorado, the Colorado Blueprint to End Hunger, Livable Colorado, many others I'm sure I'm going to forget, are key partners in our work. Living and working in rural resort communities is very different, and we have our own set of challenges when it comes to food access. I think that our group has really been poised and working towards changing the landscape of our local food system for a while. So our ability to quickly mobilize around this crisis has, I think, maybe not been as challenging for other communities across the state, because we do trust one another. We have good communication, we have good relationships, not just with partnering agencies, but with community groups. And I think that that has really allowed us to bring our services across that 3-county area in a quick manner. Over the past few years, we have learned that going mobile for food access is key. Living, 90 miles apart, living in a food desert, not having a car in some of our communities is very common. So a lot of our key partners when it comes to food access have adopted mobile practices and going into some of the more food insecure areas. And so I think having that kind of been the landscape across our communities has allowed our food bank to go mobile during this crisis. Today is actually the first day that 5 of our food banks across this area are doing drive-throughs with emergency food bags. And I know that our county is potentially looking at a larger distribution site. We have lots of resources coming our way, but there are bottlenecks to getting resources out to folks that need them. Transportation is a huge issue around here. Yes, we have an abundance of folks willing to help and give money, but people are scared. They don't necessarily want to volunteer their time to help in that capacity. So I think community members are kind of panicked and staying in their homes and not being able to get some of these resources. I think a lot of things that our coalition has been able to take advantage of is some of these food incentive funding opportunities at the state level with a lot of our partners. So being able to partner with our local farmers markets and small grocery retailers to offer food incentives for folks on food stamps. We are part of Colorado's Double Up Food Bucks initiative, which incentivizes folks on food stamps to shop at participating farmers markets or retailers to double their food stamp dollars. Our county, Garfield County in particular, has been doing a WIC Farmers Market Buck program, and that has been fairly successful at a couple of our grocery retailers as well. So I know that they're seeing an influx of folks at these smaller grocery stores right now. I think those best practices are some things that I would offer up to other food policy councils to check into and to really look at Colorado as a whole as really innovative and forward thinking in how we're addressing all of our food systems across the state. So I'm very happy to be a part of that and to be doing innovative work from a public health perspective. I think working here in a rural public health agency, I have had to wear several hats, and I continue to through this crisis. Soon I'll be mobilizing volunteers, most likely getting on the crisis call line to help folks get connected. People at our office, as well as the other 2 county offices, have done a really amazing job at putting together some comprehensive lists of food access resources in English and Spanish. And we've been sharing that widely with all of our community organizations and community members. As I said before, I think having all of these systems in place and being able to work cohesively as a group, we have already put ourselves in a position to pivot our work and really serve folks and get resources to where they need to go. I think our gaps within SANA as a result of this pandemic is our food bank has spent $10,000 in the last 2 weeks on food alone. Their normal food budget for a month is $5,000. So right there shows that we need a lot more funding to come our way just to purchase food and keep folks fed. Our partners at the Blueprint to End Hunger, Colorado Health Foundation, as well as Rocky Mountain Health Foundation, are really working with our communities to identify some of those needs and hopefully funnel much needed resources on an ongoing basis to our communities. And I think that's what I have for now.
Thank you, Dana. And last but not least, Heather from Montgomery County.
Wonderful. Well, thanks so much, Rachel and Karen and Anne and your team for all the leadership that you provide to all of these food councils around the world. And I'm grateful for the opportunity to get to hear from all of my colleagues about the amazing work that's happening, because I think we all have a lot of learning to do from each other in the times ahead. So I'm with the Montgomery County Food Council. We're in Maryland, and Montgomery County is right next to Washington, D.C. We have a population of about 1.1 million people. We're one of the wealthiest counties in the country, but we also have pretty significant income inequity, and we have about 60,000 residents who are estimated to be food insecure. Our Food Council is at this point about 8 years old officially, though we've been together for about 10. Like Don shared, we're very blessed in that we have 4 staff members in addition to our 25 council members, and we have about 500 regularly participating partners in our working groups and in our initiatives. So that's been one of the greatest assets that we've had in the work that we have done, is that we regularly convene on a monthly basis different partners, so nonprofits, government agencies, residents, and businesses around 4 main issue areas. And so that's really given us established partnerships that we can grow from in the emerging response efforts. Just to clarify, we are a nonprofit organization, so we do receive funding from our county government, but we operate independently from them. So in terms of the COVID-19 response, I'll provide some specific examples of the work that we're doing to support our community. We've been asked by our county's government to kind of be the primary point for coordinating food security response. And so we're very blessed that we have lots of different nonprofits and government agencies that all do really important work. But I think, as we've all seen in food system issues, oftentimes food is interwoven into lots of different departments, but not really looked at with a singular focus. And so that's been something that's we've been able to bring to the effort, is having relationships with those that work in seniors or in our school system or in hunger relief, or all those different areas, as well as our farms and our businesses, to have a bird's eye view of everything that's happening and hopefully try to create as much connectivity and efficiency in response efforts as possible. So we're convening weekly calls with the food security community. Those are open to the public. It's really just an extension of our food recovery and access working group, but this is something that, instead of meeting monthly, we'll have a weekly Zoom call, and we will, in advance of those calls, be connecting with the primary food banks and agencies that are providing food assistance support, to have a sense of what are the services that they currently have, what are new services that are in the pipeline, what are the challenges that they've encountered, as well as what are the needs that they have. And then on that call, reporting out to everybody, you know, what we've learned, so that we have a good sense of what's currently happening and where the gaps in services might be, whether those are populations that are not being addressed, geographic limitations. And also following that call, we'll use that call as a chance to connect with our other 70 food assistance providers that we have in the county, to have a sense of all those needs and then communicate them back out to our county council or our county executive, as well as funders who are reaching out to us, what in the community. So right now we're hearing that that's that's needed. So we're working with our county's volunteer center to get individuals who are interested in helping connected to opportunities to help. We also, obviously, there's need for funding, there's need for food. There's been a lot of concern that our food assistance providers are at tremendous risk of exposure to the virus. And so how can we get them the sanitizing and the protection equipment that they need? Currently, they're all kind of getting it on their own. So we've asked our county government if they could be a sourcing pathway for them, particularly as these products get more hard to access and also to afford. So we are going to continue to do this on a weekly basis, communicate these needs that they have, and then also be the receiving entity for offers of help. So we're in a good place right now that there are a lot of folks that want to help in one way or another. We have businesses that, for example, our wholesalers of produce say we've got trucks and we've got food that we can no longer sell to institutions. So how can we connect that to the folks that need it? And so doing a little bit of matchmaking, and we're hoping to find more efficiencies in doing that as the weeks progress. But right now it's just a lot of getting the information on who wants to help and connecting it with what we're hearing from the providers in terms of what they need. In terms of supporting our food businesses, we have a food economy working group that regularly brings together our food and beverage entrepreneurs as well as our county's food producing farms. And so we've been gathering information from them on what their challenges have been. And so, and we have a lot of restaurants and a lot of food businesses that are desperate for additional business. And so similar to the website that we've been maintaining, which is really the county's primary source of information on food assistance resources, we're also have the main website for information on what are ways to support local businesses, specifically food and beverage businesses. And so having information on which of those businesses are offering support to healthcare workers. So are there restaurants where healthcare workers can get support, because the hospitals have been asking us for that information. So we gather it, synthesize it, and communicate it back out. Similarly, the school system asked us which restaurants are offering discounted meals for students. And so again, capturing that and communicating it out. Similarly, the county has been asking us for help in connecting with retailers so that they could coordinate early openings for seniors and others with compromised immune systems, and then gathering that information through the partnerships that we have with these retailers so that they can communicate it back out. And also as they develop economic support resources for these businesses, making sure the businesses are aware of it. I think we are also building on a lot of partnerships that we've had across sectors, and that's been really important in the work that we've been doing in screen and intervene settings and healthcare settings. We've developed relationships with the healthcare community, with workforce development, with a lot of other sectors that are also trying to connect with and serve the residents that we have. Our Office of Agriculture has been doing a good job of communicating information out to our farms, but we've also been, for example, working with them to host an online CSA fair. It originally had been an in-person event. We're pivoting it to a virtual gathering, but trying to make sure that they're not losing their pathways to economic opportunities. And similarly with our farmers markets, it has been declared in Maryland that they are officially allowed to be open. However, there's a lot of misinformation out there and concerns about whether those are safe spaces or not. And so getting the information that's out there about best practices, both in shopping at markets as well as operating them, and connecting with the markets to make sure they have those resources. Just quickly, I guess I want to just make sure that we also mention that we've been connecting with regional food councils as well. And that's been a really valuable space both for us to share and speak openly about the challenges that we are experiencing. And our regional council of governments has been helpful in bringing us together for those conversations. And so a lot of what's happening at the state level impacts us. And so to the extent that we can share resources both within our state and our region, I encourage others to do that as well. And then finally, ironically, we're just about to start the process of creating a food resiliency plan for our county. And that was something that we had in the work pipeline for the coming year. Unfortunately, it's not ready. And that's something that I wish and had been saying for a while that was something that we needed. And I suppose now at least we have a good reason for an illustration for why something like that is important. To not only, we have the connections that are really necessary for an efficient response, but having a strategy in place would have been really valuable. And looking at Baltimore's example of, you know, how a community can have a plan to act on is really important. So I'll stop there, but thanks again.
Thanks, Heather. We have two related questions to what you were discussing, so we'll probably ask those before we jump into the other questions. They were related to the software or systems that you're using to communicate in terms of, is it social media or using databases or other types of systems to your network? And also, how are you organizing the connections of those who have food and who need food?
So we are using Zoom for our conferences, for our online conferences, and our other working groups will continue to meet once a month as well to convene those different stakeholder groups. So for example, for our food businesses, we'll be doing the same thing. We use Google Groups for communications of our various working groups. We use MailChimp for broadcast messaging, though there are some limits to that in affordability. And we are using Google Sheets and Google Forms for a lot of data collection. I know that there's a better way out there to do it, but that's the best that we have right now. And so each week we're sending out a link to our 75 food assistance providers to this Google form to collect their information on updated service strategies, needs, challenges, and then communicating that back out, the data that's collected in a sheet.
Thank you. Thank you all for taking a moment to share what's happening in your communities and the response that you're pulling together. It's been really helpful. And there's been a lot of chatter on the chat box as well with people sharing resources. So this has been invaluable. We will be compiling all of this at the end. Kind of in addition to sharing your responses, we got some specific questions from individuals when they registered, kind of thinking about responses in their communities and looking for additional information. And one of the questions, and a couple of questions that arose through the registration, was kind of how do we continue to support small businesses and food workers? You know, we've heard a lot about farmers markets and being able to support them, and guidance coming out about essential workers. But with retail businesses closing temporarily or however long, how do we continue to support those workers that may be laid off or cannot work right now?
This is Nessa. I can just share that our state has one primary food hub. And as I mentioned, they were supplying primarily to institutions and restaurants, and they have had to pivot to providing to just end consumers' homes. And as they've been doing that, they've been working with the commercial kitchen, and so bringing on a lot more products that were probably sold, at farmers markets and in grocery stores. So that's one way that they're working to increase the economic viability of those food entrepreneurs during this time. I would just share that.
This is Dana. I would also like to share that some ways that we can continue to support our local farmers and businesses in the food systems world is modeling off of some state funding that we have. I encourage everyone to look at this, our Farm to Food Pantry initiative, which helps fund farmers up on the front end. So it's kind of like a CSA model to seed our food banks with nutritional food. And throughout our region, we are purchasing firsts from our farmers to put into the food bank to not only support their efforts, but also to change the landscape of what food banks look like and create more equity and showing that everyone deserves to have beautiful food, no matter what socioeconomic status they are. We also have another statewide program that specifically works with community-supported agricultural groups to fund produce boxes for our WIC, women, infant, and children clients and seniors. And 2 of our 3 counties within SANA have participated in this effort as well. Again, it provides that upfront funding for the local CSAs. They get to create relationships with folks that are in need. They all benefit. They support the local economy. They support our community members, and yeah, so I think those are 2 things that I can share more with the group if you're curious about what that looks like at the state level and how that's come down to funnel our local communities.
Unless any of the other panelists have anything, we can jump to the next question.
I had just something just quickly to add, which I mentioned in my piece, but just looking to make sure that we, as our federal government is designing stimulus packages, that we make sure that we don't just bail out the large institutions who have historically just invested back into themselves, but that we get those funds to small businesses and the workers of those larger institutions more directly. And I think there are conversations around, the checks, the $1,000 or whatever it is, and making sure that those are distributed in an equitable way. And that, I don't want to be well, I don't think it's a conspiracy, but there's always dynamics operating concurrently. And so while a check of X amount might seem appealing, what does that actually, are there other efforts to cut elsewhere that we just always need to be aware of the full scene? But just to say that I think that federal stimulus question is an important one. And I know in Pennsylvania we have, I think it's coming from federal sources, but we have the state's distributing low interest loans to both small businesses and nonprofits. So I don't know, whose states are doing what in terms of that, but that's another piece. And I just shared on the side here that there's, the Restaurant Opportunity Center, and we have a local version as well as collecting funds to redistribute to workers. And I think it's important to, to definitely support people in need. Again, back to the charity versus justice, but there are a lot of organizations who are very well poised to push for more systemic change in this time, respond and mobilize, but then also go for that transformative systemic change to change the systems that we currently have that will just perpetuate the troubles. So, directing investments and resources to those kinds of organizations is, I think, important in this time.
Yeah. I'll just follow up on what Dawn said. I put a note in the chat with the link to the disaster loan program that's been ramped up by the Small Business Administration. So that's for the low interest federal disaster loans for businesses of up to $2 million, businesses that are suffering economic injury. So, and I don't want to go through all of the resources that are on the resource list that I linked to, but there are a bunch of bullets there that have disaster loan links and also links to other resources. Some are specific to Rhode Island and some are national, that relate to loan availability and other resources from the Small Business Administration and Small Business Development Centers, which are, some are going to be, like I know our local one for Southern Rhode Island, he works with hundreds of small businesses, and many are food businesses in our region, and is working hard to connect them with resources. Other places may need their Food Policy Council to help them connect the dots between SBDC and these small food businesses. So that could be a role for food policy councils, and for other kind of bullets that are specific to food business. Just if you go to that link, I'm trying to keep it up to date. Ours is, I'm trying to keep it as specific to Rhode Island as possible. So I think that's what's most useful here, but some of it will relate.
Thanks, Nessa. Noel?
I didn't have anything to add except to say I agree with Nessa and Dawn about the framing of how we understand emergency-based responses, which is both emergent and evolving, and also understanding that these problems have persisted in communities of color forever, and situations such as this exacerbate and perpetuate the existing inequities. So how do we actually think through transformative work when you have the power and the privilege to be part of an organization or an entity that has a voice, and a voice that could be used for harnessing this moment to be better. So that's what I'm thinking of, because all these conversations have happened in our community too, with farmers and with the fisher folk and with limited resource farmers and urban gardeners and healers. And we have to think about the trauma that's coming out of this particular pandemic in the larger context of existing trauma. So how do we think about health and healing while we are having conversations about response? And what does that look like when we are able to be honest with the power and the privilege that we all represent to necessitate radical change? That's what I'm thinking of.
Thank you. And that's a great framing, because I think everyone's in this emergency response, immediate need, Band-Aid approach. And we did receive several questions from groups about how do we use this opportunity to better support our system, advocate with our local governments around resiliency planning, incorporating its kind of health and trauma and assistance and therapy as well. So just wanted to put that back out to everyone also, is kind of how do we utilize this opportunity after we, in addition to having this emergency response, but how do we utilize it to better support our food systems and to build up that interest and support for them? Any thoughts?
I'm responding to Blake's question on the chat.
One thing I've been thinking about is how we can use this opportunity to lift up growers, gardeners, and farmers of color, and backyard gardeners, and people might think that these are kind of hobby things, but we have frontline communities that very much see this work and understand their work in food growing as educational and spiritual, but also bringing bringing food to communities that need it most. And so I've been trying to think about what's the best way to support. I mean, we have a whole kind of nonprofit system that supports and lots of people involved, but in this time, what would be the best way to get resources, and what kind of resources are we talking about? I've been just thinking about that. And then also because it's spring and people are thinking about their gardens. And so I've been thinking a lot about that. And speaking from an urban setting primarily.
Thanks, Dawn. We had another question that came in through the chat that relates to small businesses, and I wanted to go back a minute. Does anyone or any of your councils working towards an eviction moratorium for small businesses or nonprofits?
That's a great question. We've been working on it around just housing, but not, I haven't seen anything around businesses, but I think that's a really good question. I'd be curious if others have been working on that.
In Montgomery County, Maryland, we have a convening organization for nonprofits, which is really great, both in that they're an organization that we can learn from and model our own convening work around. And we participate on their advocacy committee and in their policy making work. And so I think that has been a helpful partnership to have, and they are looking at this issue. And so we'll be a part of that conversation for sure.
Karen, could you repeat the question again? Because I heard something about housing. I couldn't hear the rest, please.
It's about if any councils are working toward an eviction moratorium for small businesses or nonprofits.
Yeah, there is a I don't know exactly which organization created it, but they did create a renters strike but document, and folk in Mississippi have adapted it. I think it may have come from California. People in Mississippi have adapted it, and they have made it public, particularly addressing the governor to ask, homeowners who rent out properties to, go easy on rents. And I can share that document in the chat.
Thanks,
Yeah,
Noel.
that's
great.
one thing that I have seen. And then, of course, there's a huge movement for suspending student loan payment also. And New York has done something about that too. So,
Thank you.
I might pivot gear here and ask another question that we haven't really talked about yet, but I'm sure that many of you might be working on it. As schools have closed in most parts of the US, I believe by now, how do we ensure that all children have access to food at a local distribution site, even if it's not in a district that has at least 50% of the students on free and reduced meals? So wanted to see if any of you have been working on that.
I can answer that question. I know that our Colorado Department of Education has come out with some waivers on congregate meal sites to make that more flexible and to allow school districts to serve kids meals while school is not in session. In our communities, like I had said before, going mobile is really key in our areas. And in one of our school districts, we started a mobile lunch program because they are on a 4-day school week. Several of Colorado's school districts only go to school 4 days. And so that 5th day, kids don't get fed. That program has been serving those communities in that school district since school has been closed. And they will continue to do so. And I know that they are seeing really great success with it and partnering with Food Bank of the Rockies, some of our other resource centers. So they're all kind of working together to support each other on that mobile model. And the fact that it has been more flexible now, given that we have some waivers in place, I think that's gonna fill a gap for a little while until schools go back into session April 20th, crossing our fingers, but who knows.
right. The Jackson Public School District, the governor of Mississippi, Tate Reeves, has asked all schools to be shut down until April 17th. And he has signed an executive order for breakfast and lunch to continue. But I do not have data on how many schools are doing it across the state of Mississippi, but we do know that the Jackson Public Schools, Jackson is the capital of Mississippi, and we are actually doing it from multiple sites, and other feeding programs and addressing hunger programs are also happening across the city. We have 173,000 population. There's a lot of food distribution work that's happening for children, for elderly. Mm-hmm. And the public school district is active in that. And I have information on a couple of other districts, but not for the entire state at this point.
Yeah, in Rhode Island, we've received a congregate meal waiver as well. So school meals can be made available outside of the group setting. And I believe that Providence Public Schools with Sodexo created 14 pickup sites pretty quickly, like last week. Those were already in operation, but it hasn't been consistent the way that it's been developed across the state. The Department of Health has a list that they're trying to keep updated of all of the sites across the state where kids can pick up meals. There are a couple of, I guess, pain points that are popping up. One is that anyone who shows up, you can't get a meal for your child. You can only get a meal if the child shows up in Rhode Island. This is the requirement right now. So there's no ID or residency requirement, but the child has to be present to pick up the meal, which is a problem and will become more of a problem next week when the children start on their online learning, because then the the breakfast and lunch times, especially the lunch time that's a pickup time, is actually going to be during the time when they're also supposed to be online. So it's just because everything's trying to get organized at once very quickly, but that's an issue right now. And there are a lot of differences between Providence, what's going on in Providence, which is our biggest urban site, and the more like suburban and rural parts of the state.
Just quickly, in Montgomery County, similar things. We've got 165,000 kids in our school district. So we have a big geographic area and population to cover. Some innovative strategies that they've been working on. They already have 20 sites set up with 2 mobile sites. I think they're hoping to double that by next week, but there's partnerships with our food assistance providers to also take our weekend bag programs, which I'm sure a lot of other places have, where kids get some prepackaged food to take home with them for the weekend. The food assistance provider, Manna Food Center, is doing distribution of these bags at the meal sites so that kids can pick up both the meals. And we're doing 3 meals a day now, and they're all to go. So there's a way that they can get additional food beyond the meals. And so I think we've actually got 4 providers total that are doing that throughout the county. And the school system plans and may have started today using school buses to do mobile distribution, not just at individual sites, but also going to housing communities as well. So I think that's really enabling them to be in lots of places at once.
Yeah, I was just we have a kind of similar situation here, at least in the Pittsburgh district. They're using the summer meals kind of process of bagged lunches. So they have grab and go that are being delivered to the schools. We do have some instances of COVID cases in the schools. So there have been a couple of sites that have closed in the last few days because of exposure concerns. That we're also seeing actually not a lot of uptake of those meals. And so 412 Food Rescue's been working with mobilizing their volunteers to every day after the meal time. They only have 1 meal time a day, 11 to 1, so that there's been questions around breakfast and other meal concerns, but they're redistributing those meals that are uncollected to community-based partners who can then get them to people.
Thank you all. One question for Michaela and maybe Dana as well. What do you find is working with respect to outreach to the more rural areas or smaller communities that you're involved with too? So I imagine some of these strategies wouldn't necessarily be as applicable there.
So we, as a Dubuque County Food Policy Council, we were formed 1.5 years ago. When we were establishing, we reached out to all of the rural community mayors and city councils. So we are pulling on that list to see what needs they have. And we are waiting to hear back from the mayors and as well as the city council members we have connectivity with. Also, Dubuque is unique that part of our Dubuque County here in Iowa is a rural school district, which is the Western Dubuque School District. So it is a challenge to continue to try to reach out to the communities. However, we are trying to connect with the school district a little bit differently than we previously had been. As well as we have a couple greater
Michaela, I think you're on mute right now. Try again. No, I can't hear you. I don't know if others can. Karen, no.
I think it's a connectivity issue.
Can you hear me now? Okay, awesome. So do I need to start from the beginning where I was talking?
No, I think you were cut off like halfway through, but I was trying to respond to a chat at the time. So if Karen, if you know exactly where she left off.
No, I think you were halfway through what you were saying and then it cut out.
Start where you were talking about where your communication with city and town officials around what their needs are. I think that's when it cut off.
Okay, so we also have a rural school district. Am I correct there? Sorry, my audio was kind of funky. Okay, so we also have a rural school district that we can connect to pretty effectively. The school district does encompass other counties that one of which does have a food policy council. So we are trying to tag team information. And in Iowa, there's 5 food policy councils total that we know of at the moment. So we're all trying to collectively work together as best we can. But we are very new at meeting and conversing. So yes, in Dubuque County and Iowa, we are really trying to connect to the mayors and the city councils of the smaller communities to see what they can offer for us, as it comes to a space. As I mentioned before, it was something that was an issue, in many of these smaller towns. So we're working extensively with our St. Stephen's Food Bank, which is a member of the Riverbend Food Bank, to distribute to food pantries, not only in the city of Dubuque, but to establish new food pantries and deliver to those who can't get out.
And I think for our area, we're a little behind the curve on social media, but Facebook is a very powerful medium for us to use throughout Santa and with our community members in spreading the word about where resources are and correct information about social distancing, just everything around this pandemic. Our population throughout the region is around 30% Hispanic Latinx. And so really being diligent about putting everything in Spanish, press releases, radio announcements. Radio is really powerful. We have a couple of Spanish only radio stations. And I think the benefit of living in, benefit and a curse of living in a small area is everyone, or you're separated by only a couple of people. And so I think folks genuinely trust one another and know who to point someone to if they need that information. So word of mouth is pretty powerful as well. In a couple of our organizations, in our public health department, we have a Hispanic Latinx community engagement coordinator. So she has been primarily pushing out information across this region around food access resources. And then through our Santa Coalition, we have 3 bilingual community engagement coordinators who are phenomenal and are very trusted within our communities. So they have been very diligent, boots on the ground, funneling information up to myself and other organizations about needs and trying to keep folks sane during this time.
The UN, WHO website and also CDC have resources in multiple languages. I think CDC last time I checked was in 27 different languages. And UN of course has all the languages. So one thing we've been doing is I've been sharing that with the local news organizations and also with immigrant rights groups, so they can use those as resources to reshare the information, become echo chambers of how UN is producing information on COVID in real time. So that's something that we have been doing here.
Great, thank you all. Those are really helpful tips. And I'm especially interested to see more Food Policy Council resources produced in bilingual and beyond. We've been trying to seek out more of those for examples for other councils, and I think this is a good opportunity to do that. One last question as we're kind of wrapping up, and you'll also see we've asked in the chat box if anyone has any suggestions for how the Food Policy Networks team can continue supporting food policy councils during this time. Please chat in your ideas. But another question for the panelists as we wrap up. We got several questions during registration, also some during the chat, related to how do we keep volunteers and people involved in either food assistance efforts or community gardens or other types of food work safe during this. If you have any resources, we're not particularly experts on this. We don't expect you to necessarily be, but if you know of good resources to connect people to, we would really appreciate that.
Yeah, I would like to add one thing. I think this is a moment for all policy councils and anybody doing food justice work to have a lens of decolonization. And the NDN Collective has shared amazing resources on how do you decolonize collective care. And I've shared that resource in the chat box because Blake asked that question. So I really will challenge everybody on this group doing amazing work to think about decolonization and centering racial equity, human rights, and human dignity when you think about doing food systems work in the most authentic, people-centered way that people deserve it to be, and to leave this planet as is and even better, restoratively and regeneratively for at least the next 7 generations to come as we learn from our indigenous communities.
And to partner with that, in Dubuque, we have a large population of paras that are no longer at school, and they are being paid. However, they're looking for something to do. So we have a great connectivity to the Dubuque Community School District to offer, a volunteer sign up for a number of different opportunities. So we have calculated with the school district a couple sites just that they're doing, but then there's other not-for-profits offering that food access. So that's something that they're very willing to partner and get us the volunteers that we need at this time.
Thanks, Michaela. Does anyone else have any thoughts? So there's one more question I have that I might want to bring up since we have a few extra minutes, is we have a lot of examples of mobile delivery and that have been mentioned on this call. It would be great if all of you panelists and others that are listening want to share or send those in to me by email, and we can kind of compile them. That seems to be one of the things that many food organizations are struggling with right now because they aren't particularly prepared for it in previous emergency planning efforts before this. They were usually focused on natural disasters, not necessarily a pandemic requiring social distancing and sheltering in place. So this is kind of a unique experience that a lot of groups aren't necessarily ready for. So if you can send more details or links to specific types of mobile delivery efforts, I think it would be we'll compile those and share those out too.
One last thing I wanted to share is just in conversations with somebody who has been sick in the last couple of weeks and is at a food organization. She's just really underscored the idea that, there will likely be a time where many people on our staffs and in our businesses are themselves sick. So while we're operating in a response mode right now, we should be kind of keeping in mind that our own ability to work will be impacted, and so just making sure you have your backup people kind of in place and that kind of stuff. Just it's still abstract to many people, not everyone on this call obviously, but as it becomes more of a lived experience of actually not feeling well, that becomes a question.
Thank you very much, Dawn. That's really important to keep in mind. And I also have been trying to keep it in mind too, as thinking about as this hits more and more of us and our families, even if we ourselves aren't personally impacted, we might be experiencing a lot of challenging emotions and trying to work during these times when our own family members are struggling. So I thank you for calling that out. And I think we do need to take some time to pause and remember that we'll all get through this, but it's going, maybe not all, but we will get through this, and it's going to be really challenging. And let's make sure to keep time for taking care of ourselves too and our families. All right, well, thank you all for this really important important and engaging conversation. We have an incredibly long chat box of history that we're going to share back with all of you and all of the resources we've pulled together over the week. And we will, Anne, Karen, and I are going to discuss kind of how we can best work to continue the conversation in different ways and what works best with our capacity for helping out and supporting and connecting amongst all of you. And we'll be in touch soon with more details.
Thank you so much for everything you guys are doing. This is necessary. Thank you.
Thank you so much.
Thank you.
To everyone,
Thank you.
stay healthy, stay safe.
Care, everyone.
Likewise, please take care of yourselves.
Thank
Bye.
you, everybody. Take good care.
Thank you.